We'll call the meeting to order. We have one bill before us this morning. And before we bring the bill up, I would just like to thank Senator Boyd for all the work she has done on this bill. She's going to handle this telemedicine bill. Y'all recall we had a bill last year that we had multiple hearings on, and we thought we had a great bill, and it went to the House and just didn't pass last year. And Senator Boyd attended an in-court meeting and studied the issue on some model legislation that other states have done. And you might recall we had hearings this summer again on the issue. And as good a bill as we had last year, we think we've got one that's going to pass through the House this year. So I want to thank Senator Boyd for all the work she put in on the bill. So I'd like to call up now the committee substitute for Senate Bill 2738. Senator Boyd, you're recognized.
Thank you. I also want to add our extreme thanks to the Department of Insurance and their tireless work on this legislation. We've met throughout the summer. We had hearings throughout the summer. And I also want to thank all of our providers and our insurance companies for coming to the table to talk about how that we provide good patient access to telemedicine in a way that's productive for everyone. So I want to thank everybody for coming to the table, being willing to talk and really talk their issues and processes through on this. So this is a bill that is very similar to what we passed last year in the Senate twice. This also conforms to the bulletin that has been enacted by the Department of Insurance now. So we've had the experience, I will say, over the last year, well, actually almost 2 years now, at really looking at how telemedicine effectively works. So this language conforms to the bulletin about what is reimbursable from telemedicine. It also gives, one of the things that we did do in here too is we are reimbursing for real-time audiovisual, but it gives the Department of Insurance the opportunity to look at rules and regulations in regards to this going forward, when it's appropriate, when it's not appropriate. And so this bill, because of the way that technology changes constantly and consistently in this arena, this gives the Department of Insurance that ability to quickly make regulations to adjust to this so that we're not revisiting this legislation every year. So that's important, we think. I think this is really one of the most important changes that we've made in this legislation. And I think it's a good bill. I think it's a great bill. And I hope that you will support it. And I'll take questions.
Senator Blackwell.
Thank you, Mr. Chairman. This is just maybe a clarification on line 73 and 74. It reads, patients in a patient to provider consultation shall not be entitled to receive a facility fee. The way I read this is that facility fee relates to the patient. Should that not be worded differently?
Mr. Chairman, is it appropriate that I have the Department of Insurance? They've helped us work in this regulation. I have an answer to that, but I actually would like the experts to kind of handle that if you're okay with that.
Yes, ma'am, actually.
Yeah.
Bob, you're recognized. Thank you. Be great if you could speak to the microphone so our people that are watching on YouTube can hear you.
The reason that language is in there to make it clear that the patients would not receive a facilities fee. The facility itself could receive a fee, but we had to make clear because it's a patient to provider contact that the patient would not receive a fee. And that's the reason that language was needed.
When would the patient ever receive a fee?
They should never receive a fee.
Right. So it's just confusing language. If that's the interpretation, I'll accept it, but it's just confusing for me. Thank you.
Senator Blackwell, I will say this language is very typical. That is this same exact sentence you will find in other legislation across the country, just kind of clarifying this particular issue.
Senator Horn, you were next, and then Senator Hill. And then McClellan.
Thank you, Mr. Chairman. Senator Blackwell addressed one of my questions. I was concerned about that patient to provider consult and all that. But on line 40, telemedicine other than stored and forward transfers or remote patient monitoring services must be in real time. So are we providing coverage to, I guess, store and forward transfers or data that are provided to a provider for monitoring of the patient?
Yes, sir.
And the same would be true of remote patient monitoring services. So are those billable?
They are. That language was put in there mainly because it says HIPAA compliant for all of those. So the definition was clear that it must be HIPAA compliant in order to be utilized and to be able to be billed.
And we're also giving the ability to bill for audio in real time as well.
Audio is in there, and there are provisions that are built around it, so that's one of the things where it's allowing the commissioner to look at that, to bring the stakeholders to the table and discuss, when it's appropriate, when it wouldn't be. And that's the reason that language is in there, to allow the insurance department to provide rules and regulations around it.
Thank you, Mr. Chairman.
Senator Hill.
Going back to Senator Blackwell's question about on line 74 and 75, reading between the lines, I think what this means is in a telemedicine situation where a patient is remotely linked to a provider, that the insurance will not be responsible to pay a facility fee or reimburse the patient for a facility fee, because like he said, patients never get a facility fee. It's the healthcare provider that gets a facility fee. So I think that may be what it means. I just think maybe reimbursements might be a better word, reimbursements for a facility fee or something like that. But I do think it's poorly worded. I agree with Senator Blackwell. And I think what it's saying is that a patient's not going to be reimbursed if they pay a facility fee if they're doing telemedicine, or that the insurance companies are not going to pay a facility fee to the healthcare provider if it's a telemedicine situation. Am I correct in what that means?
Mr. Chairman, yes, you're exactly correct. I think it's pretty clear, though. Patients in a patient to provider consultation shall not be entitled to receive a facility fee.
So a facility fee through their insurance provider that would pay the facility is really what it's saying, I think.
It's
So if you're in a telemedicine situation, the people that are providing you the telemedicine services cannot bill the insurance a facility fee. I think that's better explained. Correct.
Let me ask Bob, if that were to read that neither health insurance, employee benefit plans, nor patients in a patient to provider consultation shall be entitled to receive a facility fee, would that clarify it? That's basically saying that none of the three entities are going to receive a facility fee?
Mr. Chairman, there are situations where, for example, that patient in the Delta goes in to see the primary care physician, and that primary care physician then initiates a telemedicine consultation with perhaps a specialist in Jackson or elsewhere. And that provider should be entitled to get, as the originating site and having a healthcare facility, they would be entitled to receive a fee. It was just trying to say that we want to make clear that patient to provider is covered. But if you're picking up your cell phone and calling your doc at MEA to get a prescription, then that patient, just because they're calling from the living room, is not going to be entitled to receive a facility fee.
If the committee is okay with the language we have now, Senator Boyd and I will get with the insurance commissioner's office and prior to bringing the bill up on the floor, if that's acceptable to everyone, and we'll try to come up with language that we think will make everyone happy. I think the intent's correct in this, but maybe there's just a little bit better way we could word it, if that's okay.
I have one more question.
Okay.
I know, I understand what y'all are getting at, but I agree with it. The patients never paid the facility fee. It's the facility that's paid the facility fee. So I think that's confusing, but my other concern is where it talks about that it will only be reimbursed if it's a HIPAA compliant telecommunication system. So that is on the provider's end that it has to be HIPAA compliant, correct? Because if I'm using a cell phone for a visit with my doctor, it's not HIPAA compliant. So I just want to make sure that we're not, that we're not keeping somebody from using a cell phone from doing a telemedicine visit, because it says any HIPAA compliant telecommunication system. So I guess that might need to be clarified on the provider end, because the patient's never going to be using the HIPAA compliant system if they're on the phone. So I don't want to make cell phones, I don't want to bar cell phones from being a reimbursable entity because that's the whole purpose of many telemedicine visits, especially during COVID, when these elderly patients are being able to put an app on their phone and do a telemedicine visit. So I just want to make sure that, this is for the provider and not for the patient. Am I correct? Or does this apply to the patient as well?
Senator, you're correct. It is only the provider that it applies to. That's one of the reasons that this bill also reflects that telemedicine is allowed between the patient and the provider, because that needed to be clarified, that it wasn't only provider to provider, but
Okay.
it is only applying to either the physician or the clinic.
Okay, so, but in a scenario where a patient may have an accident and the only way they can get their physician is by calling their physician on their cell phone, if it's a holiday or weekend or whatever, that would not be reimbursable because the physician would not be on a telecommunication HIPAA compliant system. So they couldn't do it over their phone, but the patient could use their phone. Am I correct?
Well, the patient, Senator, could use their phone. My understanding is that HHS relaxed the standards for proper platforms that can be used and devices that can be used. And that applies to providers as well. That was done in response to COVID under federal legislation. I don't believe that those relaxed standards have yet been withdrawn by the feds. And I think there's federal legislation pending that would actually make that permanent.
Yeah, I saw that federal legislation. I just want to make sure that this is in compliance with those relaxed rules for telemedicine.
It would be.
Okay, thank you.
Senator Clinton.
Thank you, Mr. Chairman. On line 67, 68, health insurance and employee benefit plans shall reimburse providers for telemedicine services using the proper medical codes. That's all been worked out now with.
Yes, if y'all remember that and Mr. Chairman, if y'all will remember, this bill originally came before us because we had problems during the pandemic. This is what came to us last year with companies not wanting to reimburse the providers who were doing visits at, I believe it's a 99214 and a 99215, particularly when it came in regards to psychiatric visits. I know that was one of the particular ones that came into place. And so this language here makes sure, and one of the problems that takes in place, it's actually almost illegal for a provider to not bill at the proper code. So when they were saying they would only bill at a 99213, we had testimony actually twice. We had testimony last year during the session, and then we had testimony this summer. So this now will make sure that providers can bill at the proper code, and that companies then will reimburse at the proper code level.
Thank you, Senator Boyd.
Senator Blackman.
Thank you, Mr. Chairman. Under what circumstances can a facilities fee be charged?
Senator Blackman, it's a good question. There is already some regulations, I believe, in regards to that, but usually you only see that in limited circumstances. It might see it in a telemedicine visit where particularly in a rural part of the state, that you have a individual that comes in to a facility, and you're seeing less and less of this. This was particularly came into play when you only saw telemedicine being able to be done from provider to provider, but they can come into a place, and usually you still got some provider to provider contact within that area right there. So they will come into a place, particularly if they're needing to see a heart specialist, let's say, and they're coming in and they're looking at that into those places. You're seeing this less and less right now because you're seeing more patient access directly through their phones, through the equipment that they're using. This came up, I believe, in the testimony of one of our cardiologists, kind of describing this during one of our hearings. So there's some, and the Department of Insurance closely looks at those things and kind of, takes a watchful eye on those approaches.
So the cardiologist has an office that the patient comes in, and this is a mobile unit or something?
No, ma'am. What they were doing is, like, if they go to their, let's say they go to their general practitioner, their nurse practitioner in a clinic, and there is a special, but the person doesn't have access to get to a cardiologist, let's say that was in Jackson. I believe that's who testified before us. And this is similar. Medicaid allows this too in their reimbursements as well. Medicaid actually just is expanding their telemedicine regulations. And we had three or four of our congressional delegation actually sign on to that legislation recently on the federal level. But what it does is it puts they are able to go into their general practitioner, and they're able then to consult with a specialist that is out of their region, and it's more practical. And the NP or the general practitioner can then kind of help assess where the patient is, and they get them hooked up to be able to do patient monitoring with those specialists. So it's not really a mobile unit or anything like that. It's generally done in the office confines of a general practitioner of some type. And they're easily entitled to that because they're taking up a good bit of their professional time to make sure that that patient has appropriate access, that they can, if the provider needs to heart rates and different things like that, that they can assist them in that kind of arena.
Okay, so aren't they being compensated for the medical services that they are providing to that patient via telemedicine?
Not necessarily.
So when you do a consult, you can't file an insurance claim on that patient for that consult.
It depends on what services they're doing at that point in time. Not necessarily. The facility fees are here when they are helping hook the patient up when they're doing that. So it's not necessarily compensated in all those arenas. So that's why this facility fee is listed here.
So you can receive a facilities fee, but you cannot receive a fee for your expertise as a cardiologist or an oncologist.
Different facility fee would not go to the cardiologist, the experts that's being consulted. The facility fee would go back to the NP office or the general practitioner's office.
Okay,
Yeah, I see where you're going with that. Yes. No, the cardiologist and the expert would be compensated at their consultation level. Not, this is where the person actually goes in. That's the facility fee.
so if I go to my family physician and my family physician has me having a telemedicine call with the cardiologist, my family physician can receive a facilities fee for my being in her office.
Yes, ma'am.
Okay, thank you. Thank you, Mr. Chair.
I don't see any additional questions. You have one, Sister Hill?
Just a comment. I guess my concern with this facility fee is to whether most doctors now work for some big medical conglomerate. So I guess my concern is whether or not that there would be some discouragement for those physicians using telemedicine whenever that umbrella organization that they work for can't get a facility fee because they're using telemedicine. So that's just a concern I wanted to throw out there. Thank you.
Thank you, Senator Boyd. What's your motion on Senate Bill 2738?
Title sufficient do pass, committee substitute.
Okay, all in favor, please say aye. Any opposed? That bill will be reported. Senator Blackwell, since you need this committee meeting room in about 5 minutes, do you have a motion? Rise and report. All in favor, say aye.